Good morning, everyone. Welcome to Early Batter San Antonio. My name is Richard Milk. We're excited to share today what we've learned about the number of children in the San Antonio early childhood education system, the scope of public funding for that system, and the size of the sector in fiscal terms. Now, what we're discussing today is the result of the first phase of a two-phase project. Phase one being a broad brush look at the largest programs, trying to get a general sense of the parameters within which we're working. Phase two will add more detail and additional programs that were not captured in the first phase. Let's start by understanding the universe within which we're working. We learned from a recent study by the City of San Antonio and Dr. Joswick of Texas A&M San Antonio that in Bexar County there are 132,000 children under the age of 5. That study also found that providers of formal care have an actual capacity that is about 30% lower than the capacity they're licensed for. This means that the actual number of children in formal care is probably around 61,000. That leaves 71,000 children who are not able to access a childcare seat. Now, looking more closely at the 61,000 that are in formal care, we learned that around 39,000 participate in some kind of program that reduces the cost of care, while 22,000 pay 100% of the cost. What programs are they participating in? The five largest are public pre-K, serving 19,000 children, followed by childcare services, 9,000 children, Head Start, 8,000, pre-K for SA, 2,000, and early Head Start, about 1,000. Altogether, these five programs serve 39,000 children, either by providing direct subsidized care or providing subsidies to offset the cost of private childcare, as in the case of CCS. So, if 39,000 of the 61,000 children in formal care are in a program that provides some kind of subsidy, that leaves 22,000 children whose families pay 100% of the cost of their care. We'll come back to those families in a minute, but first, let's look more closely at the top five programs. We start with Workforce Solutions Alamo, and that invests $101.8 million in the Child Care Services program, as well as $3 million in childcare quality, for a total of 104.8. Workforce Solutions Alamo provides services to a 13 county area, but these numbers are just for Bexar County. This is the City of San Antonio's Department of Human Services, which includes expenditures in a number of areas, primarily CCS and Head Start, but also Early Head Start, CCQ, and delegate agencies that provide early childhood services. The CCS figure of $122.5 million on this chart includes the $101.8 million we just saw in the previous slide, because DHS is Workforce Solutions' key implementation partner for this program. DHS also secures additional federal and local funding, which raises the total invested to $122.5 million. This slide shows pre-K for SA's expenditures. The primary amount goes to model preschools at a value of $30.6 million. These numbers are drawn from the last annual report and represent FY24 actuals. We tried to make the same true for all these slides. We wanted to get as close to an apples to apples comparison as possible, given that different organizations have different fiscal years, different budget cycles, and different ways of measuring things. Finally, when you add public pre-K's investment of $78.3 million, we get a good sense of the scope of public investment. Now, let's go back and look at the 22,000 children whose families pay 100% of the cost of their care. The latest estimates are that the average cost of childcare in San Antonio is about $10,000 per year. This means that families are paying around $229.1 million out of pocket. This includes the 22,000 who are paying 100%, but also $500,000 from tuition payments in pre-K for SA, as well as $7.5 million for CCS parent share of cost payments. So Stepping back and looking at the big picture, we can see how that 229.1 million compares to the other sources we've been discussing. When we add it, we see how much of the burden of cost is still being carried by individual household budgets. It remains the largest single source of funding, despite the significant work being done by other agencies. The total cost of the sector is almost $600 million. So that's phase one. We know there are gaps in this phase, that there are other providers and funders in this market, including military providers as well as philanthropies. Well, that will be part of phase two of this work. As a preview of phase two, we can share today that United Way is channeling $4 million primarily through the Ready Children program to support early childhood education. We look forward, with the help of our partners and some of you that may be listening now, to adding more detail about the great work being done in this area. That is our presentation for today. Thank you